Hello, everybody, and thanks very much for joining us for this first podcast on standards and upskilling our sector. I'm very happy to be here today with Liz Terry from Health Club Management and Julian from our Educational Services Department of EuropeActive. As we move into the active autumn, which EuropeActive has defined this fall season as the active autumn 2020, we've defined four primary areas, strategic priorities or goals for the sector, for the improvement of our sector. A lot of that reasoning behind those four areas being health, digital, community, and standards, is reasoning that is coming out of the last 5 months. EuropeActive, as we entered into the early spring, was in the middle of a strategy process towards 2025, and obviously when COVID-19 happened, we had to change our focus a bit and revise some of our objectives and goals, and to a large extent our whole reasoning behind EuropeActive's purpose and direction towards 2025. And as I said, we have defined these four overall headlines or goals for our sector that EuropeActive will back up in the coming years and develop strategies and initiatives and projects for. As health, that is the repositioning of our sector towards healthcare and health policy and public health in general, physical, social, mental well-being. And digital, which is about the digital infrastructure of our sector and digital data collection as well. Community, the way we interact and position ourselves as a sector in our communities around Europe, and standards, which we'll talk about today. And standards represent broadly the upskilling of our sector on the basis of professional standards. And again, being here with Liz and Julian, we have the best experts with us with a lot of insight and overview of our sector to speak about this very issue of upskilling the sector in order for us to take our rightful place in society as deliverers of physical, social, and mental well-being, and to collaborate with a lot of other exercise and health professionals. We need a proper professional standardized basis for doing so. So with that, I would like to hand over to Liz to introduce herself, and then to Julian. Thanks very much.
Thank you. Thank you for inviting me to get involved today. So my name's Liz Terry. I'm the editor of Health Club Management magazine, affectionately known as HCM, and yeah, happy to be here.
Okay, and yeah, I'm Julian Berriman, and I'm the director of EuropeActive's Professional Standards Committee. I'm involved in the setting up of educational standards for various job roles within the fitness sector, and those standards are applied across Europe and beyond, actually. So I look after those standards. I review and update those standards. I'm also responsible for what I hope you're all familiar with, the EREPS, the European Register of Exercise Professionals, which is a register of fitness professionals who have shown us the required skills, knowledge, competencies to be included on the EREPS register. So I think the first task is maybe to update our listeners on what the Professional Standards Committee has been doing, Andreas.
That would be very interesting to hear, Julian, how you have reviewed and looked critically at our current standards in order to address the needs of coming out of COVID-19.
Yeah, okay. So obviously, COVID-19 rather interrupted a lot of plans, I guess, and we all had to think again, and it's changed the environment in which we're operating. We've all got very accustomed to the virtual environment. Some of the barriers there, but also some of the potential and opportunities that exist in that space. So one of the things we did at the Professional Standards Committee, there is a continual process of review of our various standards. For example, the personal training standards were reviewed about a year and a half ago, and we updated there in terms of more skills around the business of personal training, how to be successful as a personal trainer, those key aspects of business such as selling and marketing plans, etc. We also introduced some new standards around technology, which are now quite or becoming increasingly relevant, and as we move into an increasingly digital age at a somewhat accelerated pace. But one of the things we also did when sort of COVID hit us, I think it sort of knocked us sideways for a while there, but we then thought, well, look, we need to conduct some sort of review in the context of COVID. So I brought together a group of people, what we would call a technical expert group, and we sat down and we had a discussion of, what are the implications for the educational standards, because we need to keep those standards updated because training providers across Europe work to those standards. So we brought together a group of representatives, employers, training providers, academics, but also practitioners, so PTs working out in the field, which I think was I'm not sure that we've done so well in that area in the past, but increasingly we're getting the practitioner view, which I think is a very important one. And we brought them together to discuss, what are the implications. So I guess coming out of that, and we're about to publish the results of that, a paper and a new qualification, actually. There were a number of areas that we sort of thought that we needed to look at. So perhaps most obviously was that area of the provision of online fitness services. So you might refer to online personal training, etc. A lot of people maybe were forced towards that situation a little bit with the restrictions around social distancing, all that stuff, that became a priority. But I think it was already here. It's accelerated greatly, the prevalence of online PT, and is here to stay. So one of the things that came out of our task force was the development of a new set of standards, a new qualification standard for the provision of online fitness services. So that will be published soon. We also, there was obviously, what we saw was a change, wasn't it? I think quite a key change, a shift towards that health emphasis, that physical activity has been seen as, in the health context, maybe rather than in that traditional, more aesthetic type context. So people see the value of physical activity and fitness type activities purely from a health perspective, which I think is an enormously positive thing, because I think that widens our appeal considerably. One of the things that came through very strongly, obviously, was health and the benefits of fitness and exercise for the immune system. So we've updated the standards and included a number of learning outcomes around the benefits of exercise and physical activity for the immune system. Employers were also telling us that a lot of their employees maybe struggled a little bit in terms of adaptability. So maybe that provision of training and fitness within an outdoor environment, and often with minimal equipment. And that was surprising for me, actually, because very much certainly when I trained as a personal trainer, working with minimal equipment and in those outdoor situations was very much part of what we did. But maybe more people are now working in club-based situations and don't have that adaptability. So we've added some content around that as well. Also, we've revisited communication skills, which are clearly extremely important in this environment as people go back to gyms. A certain amount of concern, they need reassurance, they need an empathetic approach. So we will be re-emphasizing those communication type skills, and re-emphasizing that sort of shift towards a broader focus that concentrates on not just the physical, but also the mental, the social well-being of customers, which I think is where our industry is going. I'm sure we'll talk about that later. But that's a bit of an overview of really what that task force is looking at and how we're adapting some of our standards.
Yeah, that's fascinating.
Okay, over to you, Liz. Could we hear a bit about what is your thinking around upskilling the sector and updating standards accordingly?
Yeah, I mean, I'm very interested to hear what Julian's been doing and get a refresher on that. And it sounds excellent. I think a lot of this is about moving as quickly as the market, or quicker than the market, so we can anticipate things that are coming down the track and make sure that the staff are trained up, ready to address any concerns that exist out there, and optimize opportunities and so forth. And I think it's the interesting area for me is how do we stay ahead, and also how do we make sure that the majority of people are doing this training. So, I'm very interested to find out, for example, how many people have actually gone through this reskilling. I noticed today that in the UK, Sport England has given £1.5 million.
I saw that, Liz, yes.
to sort of retool the industry, as they're saying, £1.5 million worth of free trading to retool the physical activity workforce to help businesses recover after lockdown. So we just posted a story about that this afternoon. It's called the Retrain Scheme. So it's good to see some money being put into this. But Julian, do you know how many, sort of what percentage of the workforce has now sort of done this adaptability training and mental health training and all the other things that you're talking about here?
Well, this is, so at this point is we have, just so you know, we have 150 plus, so that's probably somewhere between 150, 160 accredited training providers across Europe, and some actually outside of Europe. And they are continually providing training against our established standards. And those standards will cover a lot of the ground that I've spoken about already. So they will cover, communication skills, those empathetic type skills. And they should be covering some of the elements that I've spoken about in terms of adaptability, etc. But what we're talking about here now is that we are about to release our COVID-19 our standards, and training providers will pick those standards up and start to apply those standards as part of their accreditation status with us. So I guess this is something we're trying to move with, we're trying to anticipate, and we're trying to improve what those training providers do.
And what's your expectation in terms of, say, in 6 months' time, how many people will have been able to have done that training? So what's the pipeline looking like in terms of implementation?
Well, the pipeline in terms of implementation, our training providers will be instructed that within the next 6 months they have to implement against our standards, and they have to meet our standards. And then obviously it's about how many people are coming through their schools. So currently we have a membership of around 12,000 for EUREPs, and we would hope that those members would take on that training. In terms of the impact across Europe, I know many people, not just our EUREPs members, but many people have reference to our standards. So I would hope that would be spread quite quickly.
I think that's the challenge, isn't it? To motivate, yes. They say that you can't motivate another human being. You can only create a situation in which they can motivate themselves. And so it's how do we inspire exercise professionals to be motivated to want to seek out this extra training, so that we can be, doing a good job for the consumers that come into our clubs. Because it's great that the employers will be some employers will make a commitment to upskilling their staff, yes. But some won't, and so we need to be inspiring the individuals to. Yes, I think that's the next. How is EUREPS doing that? What's the plan?
Well, I guess in terms of, as you say, employers are very important in that piece, Liz. And that's a big part of EuropeActive strategy going forward. So Andreas would no doubt tell you that we're setting up a president's council, and that consists of CEOs from across Europe. So the intention is that we get close to those employers. We continue to show them the value of educational standards and the value of having qualified and educated staff to the European standard, and that they would then spread that out through their teams. So that's an ongoing piece of work. There's no doubt about that. But we need to get those employers on board, and we're setting about doing that. We obviously have a lot of employer members already, but we're trying to galvanise that support, I guess.
And how do you demonstrate the value? What evidence do you have?
The value of, sorry, the value
you were
of
saying
what?
that you are working to prove the value to them. So how do you do that? How do you prove the value to the employer that it's worth them investing in getting their staff sort of upskilled in these areas? Do you have evidence you show for that?
Yeah, I guess what that's about, I guess we look at two things there. So, you know, great staff make great clubs. So, you know, for me, that's about retention. So retention of clients in the first instance. So if they have better staff, better communicators, people with the skills and the qualities required, that they would retain more clients, but also that they would retain more staff. And I think obviously that's an issue in terms of the turnover of staff. And you know, we've done some research that shows that you know, people with significant experience in the industry are quite low, and you know, it tends to be that people don't stay in the industry for long. So I would hope that the value is in terms of retention of both clients and staff.
Do you have any actual evidence, sort of hard evidence, financial numbers, stats, research that really does prove the value of this?
I guess that's what we're working towards, Liz.
Yeah.
And that's the reason for the introduction of the President's Council, and for getting close to those employers, so we can actually start to evidence that value.
Yeah. Yeah, I think that's really important. And in terms of the links with the medical side, you know, there's a huge job of work to do there in terms of COVID recovery. And we've been writing quite a bit about this lately, and there are large areas where I think more work is needed. So, for example, you know, people who have chronic fatigue issues and this kind of thing need very special intervention. So, yes, you know, is it the job of our industry to manage and deliver those interventions, or is it really the job of the medical profession? And sort of where do they start and we end, and where does it become a collaboration? And how are you sort of creating standards around that and upskilling people sort of on the cusp of the medical, if you like?
Yeah, absolutely. Clearly, it's been a goal, I think, of our industry for many years to get closer to the allied health professions, to work with them, to show the preventative value of our sector in working with those health professions. I think now more than ever there is that opportunity to do that, but we obviously need the skills in place to deal with those more at-risk groups, I guess. So we already have standards at level 5 exercise and health specialists that would, I guess, be those individuals that might be working with those individuals with chronic health conditions, comorbidities, and we have various specialisms around diabetes, around working with obese populations. But in terms of COVID, it's also going to be important that, you know, do we have a role to play in terms of the rehabilitation of those individuals who may have suffered from COVID? And I think that's something that we need to address. I think we have got a role there. I think our instructors are going to find people coming to them with those sort of issues, with fatigue type issues, and we've seen that COVID actually can result in damage to multiple organs. So you know that there is a whole process there. I'm actually talking to an organisation that are specialising in this and are developing the evidence that we can then base our exercise prescription and our long-term approach to those individuals, so that our instructors and fitness professionals can have that knowledge and that sensitivity. So that is something that we will certainly be addressing. And I think, yes, we do have a role to play in that rehabilitation.
Do you know how many people are trained at level 5?
In terms of level 5, it would be in the hundreds rather than in the thousands. So I would say that we probably maybe 500 to 600, something like that.
So there's a real shortage.
The real shortage, but maybe we should deal with some of the reasons for that. And I think this is where the key lies. It's undoubtedly true that most of the members that we have on EREPs are personal trainer level 4 in Europe, level 3 in the UK. But and that we don't have that many training providers delivering to level 5 or people taking up that training. But that's about, again, it's about working with employers and working with the sector, that, you know, we can all identify the role of a personal trainer, and therefore people were willingly trained to be that person, to take on that role, because they know that the remuneration is there, that the jobs are there. But unfortunately, as an industry, we haven't together come up with that clear identification of that higher level role that individual can then train towards and then be employed to do and be remunerated sufficiently to want to do that. So as an industry, we have a responsibility to show those pathways. We've tried to deliver those pathways from an educational point of view, but we need the buy-in of the employers as well, in terms of establishing those roles within their clubs. Now, I think this shift towards a greater health focus will undoubtedly drive that. We need those roles, actually, those more health-facing roles, not just for specialist groups, but for the whole population. We're always talking about growing the pie and reaching out to new markets, etc. So one of the things I'm doing at the moment is working as part of an Erasmus Plus program, the New Health program, which is developing the role of a healthy lifestyle promoter. So these are people within communities trained to understand the benefits of physical activity, healthy eating, mental health, etc., and to spread those messages. But, you know, in the UK, I think maybe Liz is the health coach, but there's health navigator roles developing across Europe. There's happiness coaches, those lower level roles, so that we can almost sort of infiltrate communities with those individuals, with the skills to give the right messages, with those communication behavioral skills to influence people in the right way. So we need to address, maybe in terms of skills, both those lower levels, but also the higher levels. But we need, as an industry, to clearly identify those roles. Yeah,
I totally agree. And, you know, we talk a lot about the opportunity to grow the market and to offer services which are much more holistic and much more curative interventions. And if we are going to sort of, you know, really meet the medical profession and be a valid partner, we have to have greater numbers of people doing that training, which is going to require a commercial adjustment, I think, for operators to develop a membership that's prepared to pay for those kind of services, and then be able to open up jobs where people can be salaried to do that extra level of training. And if we're ever going to do it, I mean, now is clearly the time. You know, the need is there. We've got hundreds of thousands of people who have been badly damaged by this virus and who will need to be rehabilitated. And I don't wish this to sound inappropriate, but there is a certain amount of competition for that work. You know, we see in the world of physiotherapy that physiotherapists are very much gearing up to help those people.
Yes, indeed.
And there are various other disciplines which are coming forward. The spa and wellness industry is starting to launch COVID-19 recovery programs and so forth. So, you know, we're in there with 4 or 5 other sectors competing to help these people effectively. And if we don't have the setup to do it, they won't see gyms as a place where that can happen. And we will have missed this opportunity. And I think we could do a very good job, because exercise has to be part of this, but it does have to be very, very carefully prescribed.
Listen, Julian, thanks so much for sharing your expertise and your passion for upskilling the sector and for professional standards for our sector. That's really really lovely. We'll have to conclude soon. So I'll just say that, of course, 2 areas we shouldn't miss in this regard is upskilling our leaders, our executives, our managers as well. And therefore, we're extremely happy that we'll be launching the Active Leaders program with IEC Business School and the EuropeActive in the coming year, focusing on really upskilling and strengthening our managers and our leaders around the industry. And another important area, I think, in this regard is our collaboration with universities around Europe and the production of evidence and science underpinning our standards. and therefore our initiative with Think Active, we really we feel is very promising, and it will help us inform our production and review of standards based on the newest and most relevant science that is coming out of our university partners around Europe. So that people can read much more about on the EuropeActive website. Thanks so much for joining us today, Julian and Liz. It's always a pleasure, and thanks so much to the audience for joining us. And we will tune in again on the 24th of September for the next EuropeActive podcast. Thank you very much. See you next time.
Thank you.
See you next time. Thank you,
Bye-bye.
guys.